is the ovary, and then every 28 days or so, under LH influence, we saw um, the ovary release the egg, the secondary oocyte, and it actually released, um, you know, depends on the maturations of the follicle. So it could be on the right hand side, on the right hand side, on the left hand side, left hand side, left hand side, left hand side, right hand side. So there's no such thing as alternating between right, left, right, left, right, left. It's basically is whatever the oocyte mature is actually is going to release. Uh, Thus, in some case, then it could release two oocyte. In that case, if two have been be fertilized, then you will have fraternal twins because there'll be two different secondary oocyte and two different sperm. So fraternal twins are not very similar. But if it's one fertilized oocyte split, and then it can give rise to two identical twin. The so the fallopian tube or the uterine tube would have a tube that would fimbrate surrounding the ovary, and it would be to receive the secondary oocyte. The inner lining of the fallopian tube would have a cilia, if you will, that involving the sweeping motion, and then thus to sort of like sweeping the uh, secondary oocytes toward the um, uterus, as you can see here. Okay, the uterus, and you have at the uh, inferior portion, that's the cervix, and the cervix. This one, female cells of the cervix, is where human papillomavirus typically like to divide. And Dr. Papanukulou devised a ways, uh, which is to do the pap smear test, which is to scrape the cervix, and the cells in the cervix will tell you whether a person might have cancer or not. The vagina, you can see here, and it has rugae structure. It can, this means to a long elongation if it's necessary. And the vagina open up into vagina orifice. And then that's what would fall within the vestibule. And the vestibule will have a homologous structure to the glands of the penis, would be the clitoris, the urethral orifice. And you see how the female urethra is very short relative to male. Thus, female tend to get easy to get infection, urinary tract infection, that can lead to pelvic inflammatory disease. Okay, so if you do the horizontal or transverse sections, so this is the anterior and this is the posterior, and you can see how the urinary bladder sit in front of the uterus. So it's kind of like the uterus kind of hugging on the, you can see how this is kind of like hugging the urinary bladder, sits on top. Okay. Okay. All right, so there's a lot of muscle here. I'm not going to talk about those muscle. And there are pretty much 4 ligaments that holds the ovary and the uterus in place. Okay, there is one type of ligament that, you know, like it's kind of draped down the whole thing. This is known as the broad ligament right here. Okay, just like a sheet that's sort of like draped down and everything. The ovary is held in place by the ovarian ligament, as the name is in place. The suspensory ligament holds the kidney. The ovary is in place, but in the suspensory ligament, you might see blood vessel that travel through there as well. Okay, so that's 3. And then there's another round ligament, and that sort of like holds the uterus in place. So that's the 4 types of ligament. Now, if you do a histology of the ovary, you can see that this is the primordial follicle that sits in the cortex near the end. Okay, so female might have a lot of these primary follicle, but they sit there. But in her lifetime, a female only produces roughly about 480 or 500 secondary oocyte in her life. So in other words, she's produced or released 500 secondary oocyte in her lifetime. Okay. Write this down. So if you look at typical example would be, say, how many oocyte does a female produce in a year? Well, only 12, because each month she produces 1, right? So if you say, let's say she has her first menstrual period when she's 15, and usually by the time people reach about 55, she will be in a period called menopausal, stop menstruating, and so roughly 40 years. Right? So if you take 12 times 40, that comes about to 480. 480 oocyte. And these primordial follicle, if it has FSH, follicle stimulating hormone, right? And some of them started to grow bigger, like this one right here, okay? And then under FSH influence, it becomes this one, okay? So see this liquid space here? This is known as the antrum. So at this stage of the follicle, you can say, oh, this is secondary oocyte. Sorry, this right here is secondary follicle. Secondary follicle. In secondary follicle, at the very beginning might have primary oocyte, but then they will undergo changes. They become secondary oocyte. Okay, and then they stop development there. So there's this primordial, the secondary follicle become bigger to become Graafian follicle. So Graafian follicle is ready to rupture. Given LH, it will rupture. Okay. Okay. And in development of oocyte, remember you have to show you compare and contrast between spermatogenesis and oogenesis. In spermatogenesis, you have, say, spermatogonium that give rise to 4 sperm that look very similar, okay, in size and shape. Genetically, they might be different. In oogenesis, however, the product would be the secondary oocyte. If it's fertilized, right, if it's sperm enter, it will finish as meiosis 2 to form a second, or this is called secondary polar body. But after the first, so here's the sperm actually when the sperm enter, and it finishes meiosis 2. If it's no sperm, it just dies as a secondary oocyte. Okay. Remember, secondary oocyte started meiosis 2. Primary oocyte start meiosis 1. At the end of first mitotic division, you get a secondary oocyte and the first polar body. Okay. And if the sperm enter, this secondary, first polar body, also known as, can be considered as a secondary oocyte, but it doesn't have a lot of cytoplasm. So that's the key difference between this. finished meiotic, second meiotic division to give rise to the polar body. So this one is a little bit confusing, but just say that at the end of the oogenesis, should you have fertilization, you have one mature oocyte and 3 polar body. Okay, only 3. Okay, and unlike the spermatogenesis where you have different sperm, this polar body is often found as part of this cell. Okay, so it's still it's almost like it's one cell, right? It doesn't separate into its own entity like we see with the sperm. All right. Now, again, so you can see that primordial follicle give rise to the primary follicle, which give rise to secondary follicle. Inside, you have the primary oocyte, which eventually will give rise to secondary oocyte, like this. Okay, the secondary oocyte will have this lot of cells, follicular cells or granulosa cells surrounded. That is known as the corona radiata. And so when the first sperm that entered this, it has to remove the granulosa cell away. So it will release hyaluronidase, for example, to remove the granulosa cells away, and then it can enter. So it causes an acrosome reaction. All right, so this is the scanning micrograph showing us the ovary. You can see a lot of primordial follicle out here. Starting follicles under FSH in fluid will become primary follicle. It'll get bigger, so it becomes more like this, which is mature or Graafian follicle. And this is almost ready to rupture. Okay, and then once the rupture follicle, what you see here is degrading follicle. This will become ultimately the corpus luteum if there is a lot of LH. If the LH disappear, then it becomes this right here, corpus albicans. Great picture shows you that under LH influent, you can see that the secondary oocyte is inside, and it still has a lot of cells surrounding it, the granulosa cell, okay, forming a crown, the corona radiata. And then usually the fimbriae of the fallopian tube is in close contact, so that when this oocyte is released, it will hop into the fallopian tube, uterine tube. Okay. You can have fertilization outside of the fallopian tube. It's called ectopic pregnancy, but that's very dangerous because only the uterine wall is thick enough to accompany the enlarged fetus, but anywhere else, it will be dangerous for the mother and the baby. All right, so follicle development is this. Within the follicle, right, you have the oocyte that is developing, right? Primary oocyte and secondary oocyte over here, right? And you can see how after the first mitotic division, you get the secondary oocyte and the first polar body. The first polar body is still kind of attached to it, so it's not like a sperm, right, that is separate by itself. In this case, it's really attached to that. So again, follicle developments are primordial follicle, become primary follicle, and secondary follicle. The difference between primary and secondary is the presence of the liquid known as the antrum. Okay. The liquid here is the antrum. And the antrum is the secondary follicle. All right. So in the secondary follicle, you see a primary oocyte, but they also develop into secondary oocyte in the secondary follicle, and then continue on with the Graafian follicle. And L8 causes ovulation. L8 causes the rupture follicle become corpus luteum. Corpus luteum put out progesterone. Same thing. All right. Now, the accessory gland of the female reproductive, of course, is the uterine tube, which is the fallopian tube that serves as a conduit, if you will, for the secondary oocyte to travel down to the uterus, which is this muscular, and then vagina here. So the uterine tube. Now you can see here's the broad ligament, right? See how the suspensory ligament has artery, blood vessel, okay, and nerve travel in it. The ovarian ligament holds the ovaries in place. The round ligaments sort of like hold the uterus in place. Okay. The endometrium is the innermost layer of the uterus, has two layers, stratum functionalis and stratum basalis. A drop in progesterone causes the slough off, or you losing the stratum functionalis. Okay. So the uterine tube conveys the eggs toward the uterus, and how it has this cilia, which causes this sweeping motion, if you will, right? Very similar to the lining of the respiratory tract. Okay. Now, if you look at the endometrium or the walls of the uterine, you will see that it has, here's the perimetrium, is outside. The muscle is myometrium, and this right here is the endometrium. And all these dots here, what it looks like, these are glandular, right? So under progesterone, these glands will develop, so then you can produce a lot of milk, right? A lot of fluid in kind of like creating a fertile soil for the blastocyst to implant. The uterus is this thick muscular organ that you can see here. Now, interestingly, do you guys know what's it called when you remove the uterus? What is the procedure called?
Hysterectomy.
Yeah, hysterectomy, right? Hysterectomy. Now, if someone tell you a joke, right, and you say, "Oh, she's laughing hysterical," right? That's hysterical. You know, laughing hysterically, right, or hysteric, and hysterectomy has the same root word. Do you notice that? Why? Is because initially psychologists thought that if you stimulate the female, right, tickling her, and she will feel excited, she will be uncontrollable laughter, hence their name. But histo refers to the uterus, okay, so hence their name, hysterectomy. Okay. Yeah, and nowadays, you can, so some female might develop endometriosis, which meaning that the endometrium could develop other places, like in the fallopian tube, and so forth, right? Maybe outside. And because it's an endometrial tissue, it's under influence, hormone influence. Estrogen causes it to proliferate, and progesterone causes secretion. And they do, if there's a drop in progesterone, the spiral artery, which you can see here, no, you can't see the spiral artery that is inside. The spiral artery without progesterone, it's going to constrict and it's going to break, bust. That's why you get very bloody tissue. So the endometrium that goes somewhere else can become bleeding. And so when a woman start to have bleeding outside her normal period, right? So let's say that normally you have your period on the 20th of a month, right? So you expect to have it, but you shouldn't have it on the 10th. You shouldn't have it the 8th of the month. So outside of that menstrual period, that's a worry. Okay, it suggested endometriosis, uh, and in some women you can have a lot of fibroid develop, so become really big. Okay, and in that case, then you can actually remove the uterus hysterectomy, and they can do it laparoscopically. So basically, you just may have 3 holes, right? One with the scope, one with the scissor, one with the pouch. Uh, cut it and put it in the bag and pull it out. Okay. Uh, the vagina is this muscular tube. It has rugae, very similar to the urinary uh, uh, bladder. So that the urinary bladder, if it's extended, it will stretch, but if it's in when it's empty, it's infolding. So you can see here similar concept. This area has a lot of bacteria, so it's going to have a lot of acid produced. Right. So when the male deposits the sperm, he usually deposit it here in the fornix area. Okay, and then most of that sperm will die in the vagina, unless there's a mucus in which that guides the sperm to swim upward. The female external genitalia, you have the labia minora, right, which are the that forms as the vestibule. So the vestibule have your clitoris up here, your urethral orifice, and the vagina orifice. This is because the blood vessel come really close to this area. That's why it's look red. Uh, and that's labia minora. Labia majora is outside. That has a lot of hair. Okay. This is also known as the female vulva. Labia majora, round folds, adipose tissue, enclosed protects the other external, uh, and it's in up here in that mons pubis. Labia minora is this inner fold where supplies the blood vessel. By the way, the clitoris, similar, is equivalent to the male, the glands of the penis. Okay, so the glands is part of the corpus spongiosum. So it has a lot of nerve endings. So you can stimulate the gland or you can stimulate the clitoris here. It has a similar structure. There is a disease known as congenital adrenal hyperplasia, in which there is a defected in cytochrome C, but usually in the female is congenital adrenal hyperplasia. They have a lot of testosterone as a girl, so as such, you could see that the clitoris could become very big. Okay? Um, I think I might have a structure for you guys. Give me, I'm going to share with you my screen. And I'll show you this uh, um, endocrine problem in congenital adrenal hyperplasia. All right, sharing the screen. Is it the screen sharing now? Nope.
You have a whiteboard.
How about now?
Whiteboard.
I know. The system is a little slow.
You're sharing screen. I don't know what you're looking for.
I'm looking for this condition. So by the way, if you guys successfully completing 301 and you want to take more disease, that that an extension of 302, sorry, you're taking 301, 302, and you understand the normal process. And if you want to understand the disease condition, right, the abnormality, then I suggest you should take the pathophysiology bio 425. Okay? And in bio 425, we look at some of the diseases. In this case, we'll look at the endocrine. And I want to show you that in the, okay, so you know that the adrenal cortex put out steroid hormone, right? And that in the steroid hormone, the synthesis of steroid always start with cholesterol. And from cholesterol, you can make progesterone, you can make estradiol, you can make testosterone, okay? Now, in the disease called congenital adrenal hyperplasia, there is a defect in this enzyme, okay? As such, you don't have any cortisol, so it's a hypocortisol secretion, right? But if you can't go from here to here, this thing is going to back up, right? The 17 alpha hydroxyprogesterone is increased. As such, it's going to cause this normal root to make more of the androstenedione. And this androstenedione would then make more testosterone, okay? And as such, this is the congenital adrenal hyperplasia. You see that? And this will show you that how this is a female, but under testosterone influence can stimulate. This is her clitoris, and it looks like a penis, right? But I'll tell you, this is not a male because there's no testes here, so there's no scrotum, but you can still see labia majora here, okay? So that's it. So that just shows you how the clitoris is very similar to the gland of the penis, homologous structure. All right, stop sharing. Okay, so the clitoris, you can see that up there. Vestibulars, within the vestibule, this is where your has a lot of nerve endings, so you can stimulate that. Okay. All right, so this is sort of like a summary, and very similarly how I told you that the parasympathetic nervous system stimulates the male erection, and the sympathetic is involved in ejaculation. Well, similarly in the female, the parasympathetic, it's going to, when you stimulate it at the clitoris, it's going to get intensified. And then some of the vestibular glands started to secrete mucus, right? And certainly you have a similar ideas coming that the erectile tissues, right, the clitoris will get dilated because there's a relaxance of the blood vessel, and then continuous stimulation will reach to the orgasm, which is basically rhythmic contraction, and this is mediated by the sympathetic nervous system. Okay. All right, so maybe another 5 minutes or so. We'll take our 5-minute break, and then we're going to talk about a little bit about human development. So I mentioned earlier So usually around 55 age as the woman reaches menopause. She doesn't cycle anymore. And typically, we see the menopausal woman, we have hot flashes, uh, and don't know what really caused that, but apparently some woman taking estrogen supplement or similar molecule helps that. So we know that when a woman reaches menopause, her ovary is not working anymore, reduced level estrogen, progesterone. Maybe some of the secondary characteristic will disappear, but it may, sometimes it may not. Definitely not as much fat tissue in the buttocks or the breast. Okay. Hot flashes is very common, probably due to the lack of hormone. All right. So I told you here, this is a little bit regarding the mammary gland development. This is the mammary gland that is fully engorged, right? The alveolar. This is considered as mature female and perhaps lactating mammary gland, if you will, right? Because developmentally, it doesn't look like this. It's more like a duct or tree, okay? So that's estrogen influence will show that. And then under progesterone, these alveoli become differentiated, right? And then during pregnancy, prolactin causes these cells started to produce milk. I don't know, you guys remember that when we talk about the endocrine system, the hypothalamus is regulate the anterior pituitary secretion. So there is prolactin releasing hormone and prolactin inhibiting hormone. So in most people, the prolactin inhibit hormone is released into the hypophyseal portal circulation. But in some cases where if the tumor, particularly the pituitary tumor, get too big, that can grow out, so called that supracellular mass, it can impinges on the blood flow in the hypophyseal portal circulation. So then if there's no prolactin inhibiting hormone preventing the mammary gland from developing, the mammary gland, the anterior pituitary will put out prolactin, which then has the mammary gland development. So if there's no prolactin inhibiting hormone from the hypothalamus, the anterior pituitary will put out prolactin, which stimulates the milk produced. You also see that in male as well, not just female, but male can produce some milk. It's kind of, wow. Yeah. Okay. All right. So I'm not going to talk about sexual transmitted disease and so forth. Let's end it there. Are there any questions? I'm not going to talk about birth control either. So why don't we take a 5-minute break? I'm going to stop here. And then I posted for you human development. So we're going to do, let's say, 40 minutes on human development. I'm going to stop here. Any questions?